Today, we're going to deal with one serious problem that is considered as a medical emergency in urology. And we're going to talk about twisted testicle, or in medical terms, the torsion of the testicle. In fact, the testicle torsion is actually quite common. It can happen in 1 in 4,000 or 1 in 25,000. And the two age group that it affects are the newborns. Sadly, the newborns can't complain about testicular pain, and only parents who examine them find the testicle to be a little bit swollen and red and sometimes turn black. However, the second group of young adults or adolescents, it happened between age of 15 to 25. And therefore, young adults who suddenly have this sudden onset of pain, for example, young man who is sleeping and who is oblivious of what's going on, in the middle of the night, the symptoms are sudden onset of pain as if they're kicked in the balls, and suddenly they have that nauseated feeling and they want to actually vomit. And whatever they do, they can't relieve the pain. They're running around and they can't get quite restless. And this is a part where we really need to take this young chap to the hospital to examine to find out where they've got torsions. The risk factor of getting this actually is something called a bell clapper syndrome. If you imagine that the testicle is actually floating around too much, it moves around too much, and then it will cause the twisting. And funny enough, this doesn't happen when you go beyond 25. It's quite rare. So the risk of it is that if you are much younger and suffer from undescended testicle, you might have increased risk of this by about 10 to 20 times. Or if you have got big testicle, so big balls is not always good, and that might be more prone to twisting. So as a urologist, when I attend to the patient, I want to get in quickly, and the only way to cure this is an operation. The operation itself will untwist the testicle and hopefully stitch it, and so the actual twisting will not happen again. And when we do that, we will fix the other side too. Sadly, in my job, sometimes I attend to the patient too late because they present too late. Under that circumstance, we need to chop off the balls, and we do a procedure called orchidectomy. Clearly, if you're at risk on one side, you're also at risk on the other side, and therefore we need to fix the other side doing a procedure called orchidopexy. So the trick really is for the general public to understand that young age group men, it's not just because they are sexually active or anything like that, they're just more prone to twisted testicle. So from one testicular condition, we're moving to another testicular condition. Earlier on, I highlighted that some testicle might get stuck or might get hidden. It's a condition called undescended testicle. If you're really keen to find out this information about undescended testicle and what impact it has on you in increased risk of malignancy, then you know what to do. Stay tuned and carry on putting Dr. G on the spot.